So a question I get asked very often is, Doctor, I've got back pain, but who do I see? Is it a physiotherapist? Is it an osteopath? Or is it a chiropractor? I mean, what do they do? And which one is the best? I'll let you know at the end of this video. You find that each of these specialties have the same goal but different approach to treatment with some similarities. Now, what do physiotherapists do? When you think of physiotherapy, you're probably thinking of, oh, they just do exercises for knee or back problems, but physiotherapists are much more than that. They take a holistic approach, looking at your lifestyle and well-being, while dealing with body systems such as musculoskeletal, neurological, cardiology, and respiratory. So you find that physiotherapists will specialize in one or more areas, such as neurological physiotherapy, helping with muscle weakness, balance and coordination due to strokes, brain and spinal cord injuries, MS such as in multiple sclerosis, and Parkinson's disease. You have musculoskeletal physiotherapy, which involves muscles, joints and ligaments, and they help with back pain, arthritis, and joint problems, as well as rehabilitation after surgery, for example, knee and hip surgery. Then you have cardiorespiratory physiotherapists, which help with cardiac rehabilitation, for example, after a heart attack. And they help with lung problems like asthma or cystic fibrosis, where they might help to improve your breathing or help to remove excess mucus from the lungs by drainage. You also have pediatric physiotherapy, where they specialize in children under the age of 18 and disabilities such as cerebral palsy, where they help with movement, coordination and strengthening. For treatment, they will employ different techniques such as joint and soft tissue massage and manipulation and mobilization, stretches and exercises, hydrotherapy where you have exercises done underwater, ultrasound waves to reduce inflammation and increase blood flow to the damaged tissues, use of TENS machine for pain relief, which is transcutaneous electronic nerve stimulation, and several other techniques, as well as general education advice about posture correction, mobility aids, fall prevention, and lifting to prevent injuries. So what do osteopaths do? Similar to physiotherapy, osteopaths would also provide holistic care, treating the body as a whole and looking at your tendons, joints, muscles and ligaments, in addition to your posture and your lifestyle. Like physios, they have a good knowledge of anatomy and physiology. Osteopaths can treat a whole range of conditions such as joint pains of the back, knee, wrist, shoulder, elbow, as well as sports injuries, fibromyalgia, frozen shoulder and migraines. Whereas with physio, who can employ a range of techniques such as use of the TENS machine or ultrasound waves, osteopaths tend to rely more on their hands, so they have a very hands-on approach to do massage, stretches, joint mobilization, manipulation, and exercises. And the aim is to reduce pain, increase blood flow, and improve joint mobility. One thing in particular that osteopaths are quite good at is, for example, back pain. They can do what we call high velocity thrusts. These are short, sharp movements to the spine, which normally produce a clicking noise, which is like cracking your knuckles. So I'm just going to try that. Ooh. Now that's the clicking noise you hear when osteopaths are working on your spine. So what do chiropractors do? Chiropractors' main role and focus is in spine or joint manipulation, so they're not as holistic as physios or osteopaths in looking at the rest of the body or that holistic approach that you would normally get. I mean, they work on the basis that misalignment of the spine could be the root cause of your joint problems, and they can use their hands as well as small instruments such as the TENS machine or ultrasound to do adjustments such as the gentle alignment of the joints in your spine, or similar to osteopaths, they can do sudden controlled force to improve mobility. They can also do soft tissue therapy to relax tight muscles, exercise and stretches, and giving advice on diet and nutrition to help, for example, reduce the inflammation in your body. What chiropractors are good at is what you might need 4 physio sessions before you start to see benefits. You might need just 1 chiropractor session where you get immediate results. Unlike osteopaths, chiropractors can do investigations such as x-rays to help come up with a diagnosis and to also formulate a treatment plan. I mean, chiropractors specialize mainly in neck and back pain, but chiropractors can deal with other conditions such as migraines, chronic headaches, sports injuries, and other joint problems. Expect to feel some soreness or tiredness after manipulation, which might last for a few days, but be very careful because though this is very rare, spinal manipulation can cause complications such as pinched nerves, slip discs, or even a stroke after manipulation of the neck. In the UK, there are certain instances or conditions where it's not advisable to see an osteopath or chiropractor without seeing a doctor first. For example, if you have osteoporosis, if you've got cancer of the spine, if you have spinal cord compression, if you've got conditions such as multiple sclerosis, or you're taking blood thinning medication, for instance, it's preferable to see a doctor first before heading straight to see an osteopath, chiropractor, or even a physiotherapist. Now you want to know which is the best. You might have back pain, or you might have knee pain, or hip pain, or a joint problem, and you want to know which is the best I should see. I mean, there is no evidence to suggest that a chiropractor is better than an osteopath, or that a physio is better than a chiropractor. This all comes down to personal preference or recommendation from friends, as well as what your doctor suggests. For example, if you find that you visit a chiropractor and after a few sessions that's not working for you, of course you can switch to see a physiotherapist or an osteopath. Whichever one you see, you want to ensure that they have the right qualifications for that specific problem. As for example, I mentioned physiotherapy specialize in all different aspects. So if you've got back pain, you might want to see a physiotherapist that specializes in back pain as opposed to one that specializes in knee pain. And also you want to make sure that apart from the right qualifications, they have the right membership. A physiotherapist should belong to the Chartered Society of Physiotherapists, for instance. So you have to ensure that you're not actually seeing a quack physio or quack osteopath or quack chiropractor. So whichever one you see, the whole idea is that they should help with your problem. Now I hope that you find this video useful, and if you have any issues regarding osteopaths, chiropractors or physios, please drop a comment below and feel free to subscribe to my channel.